Good morning, Lisa. Would you please introduce yourself?
Hi, my name is Lisa Mays, and I have, oh God, I'm so stuck.
Good morning. Would you please introduce yourself?
Yes, my name is Lisa Mays. I have been a patient of capital otolaryngology for many years. I have had hearing loss for about the last 10 years. I've got otosclerosis, which is a genetic condition of hearing loss. My father had his hearing aids and lost his hearing when he was in his early 30s, and has had multiple rounds of hearing aids that just didn't work well, and I grew up with his frustrations with that. So when my sister, who first started developing hearing loss about 10 years ago, was met with that, we were both joking about how we'd have to have, really old-fashioned hearing aids and they wouldn't work, and oh my gosh, it's going to be really hard to grow older that way. And so she had a stapedectomy surgery to fix the otosclerosis, which worked for her. I followed suit and had that same surgery, and it failed. But when I was offered then the option of a hearing aid, the BAHA, the bone anchor device, I really wanted to, look at that and explore it. My hearing loss was really slow. It was a slow onset. It was very frustrating. I just became one of those people that kept saying, what? And I would repeat things and it wouldn't be correct, and it wasn't really obvious, but that's the way it is with otosclerosis. But it got to the point where every single time I would ask my kids, who were very young at the time, Mom, why can't you hear anything? And it's like, oh gosh, I should address this. And I love capital otolaryngology. As I said, I've been a patient with them for other ENT issues, but decided that I would ask them and their wise advice about otosclerosis. So I went ahead and pursued once I met Sabrina and the audiology department.
How is your hearing now with the BAHA device?
Amazingly better. Just amazingly better. I actually tried. That was a great thing about this department, and I truly have appreciated working with the audiology department, because they even gave me an option. So I tried a trial version, which was kind of interesting, of the BAHA, and was able to see what the difference is between bone conduction versus air conduction, or in-the-ear hearing aid. And then when I tried went from the bone conduction to the in-the-ear hearing aid, it was remarkably different. I mean, it was just, it was tinny. I didn't like it. It was just an amazingly big difference between being able to hear this almost stereophonic sound. When you go from not being able to hear out of one ear completely, and to all of a sudden having this sensation that you're having that in stereo, but you can't even quite figure that out. It was so much better. I could go to movies and I could hear better, and more importantly, I could be in a social setting where there's lots of din and noise, and not have, like my dad had always experienced, this tinny vibrational thing that went on when he was wearing his normal hearing aid. But when I would out there, it was as if it just had a, I don't know, piped in stereo system. Plus I can hear, a TV across the house, across the distance of, I don't know, 1,000 feet or something. Which is, I was not able to do. I had to turn it up to full blast, and the kids were going on and on about, oh, you're getting old. So, anyway, my hearing is much better.
What advice would you give someone in your similar situation?
Don't wait forever. Enjoy the fact that you can really. I would definitely pursue a BAHA if it's an option. I do understand that sometimes it's not always an option for some hearing loss. I just happened to, in a way, luck out that I was able to have this as my option. I would definitely get it. And I know that there is two different options of the bone anchored device in that there is a peg and then there is the magnet. And I have to say I am really happy with the magnet. It's minimal upkeep, maintenance, because it is not, it's completely closed system, the magnet's underneath the skin, you're not concerned as much about maintenance of that, care of that. Plus it works well.
And what advice would you give someone looking for an ear, nose, and throat physician or an audiologist?
Oh God, I'm sorry. I have a lot of faith in capital otolaryngology, and I know that sounds like I'm just glowing, but it's very true. I'm in the medical field, and I come across lots of people with different ENT type of issues, especially hearing loss, and I've always recommended them to hear. It's a great group. You get taught along the way about everything that's going on with you. You definitely feel like you're a part of the process, and that's been really necessary for me. I mean, being in the healthcare field, I want to be able to talk to other practitioners who, first of all, know what they're doing, and more importantly, make you feel like you're part of the process since you're the patient. Anyway, I guess hopefully that actually answered your question.
Would you show us what it looks like?
Oh yes, of course, I would love to. So this is it, and it's so subtle. That's the other thing, is nobody can tell what it looks like. Let me just pull my hair back. I have actually kept the there's a little basically a leash I like to put. This is the hearing aid itself. With the magnet option, you just simply take it off and you put it back on, which is one of the coolest things possible. It does not hurt. There's no pain, a little bit of pain, of course, after the surgery, but you just pull it off and put it back on, and then it's a distinct difference. I like the leash, and I have kept that ever since Sabrina gave this to me. Goodness, now a couple years, and it holds on to your clothing, because it takes quite a bit of strength actually. It takes a little bit of effort to pull it off the magnet, so it's not going to easily fall off. But I like this because you can kind of pull your hair back or put your ponytail on and that kind of stuff. So it's nice to have that ability to keep it close.
Well, thank you very much for sharing that with us.
You're very welcome. I've been really, really pleased with this whole process, and I'm so thankful I don't end up having to have a hearing aid with big pink fuzzy feathers and antenna all over the place, and it just works so much better. It doesn't bother the inside of my ears either. Thank you.
Welcome. Thank you.